It doesn't always take years of heart disease to lead to a heart transplant. A simple infection can do enough damage to land you on a transplant list. In tonight's Prescription Arkansas report, new hope for those awaiting a new heart.
We've read, and it can happen from cold, from pneumonia, it can happen from arthritis. There's, just regular infections that you would have and not even think anything about it.
Chuck Simons thought he was just getting another head cold when he went to his doctor in Hot Springs. That doctor visit ended like a bad dream.
So he came back in and said, Chuck, it's not a head cold. He said, this is one of the worst EKGs I've seen. So then he sent me over to a cardiologist in Hot Springs, and they said, you get to get checked into the hospital, do not pass go.
He wasn't a candidate for the pacemaker or defibrillator, so they tried to treat him with medications. It soon became clear the medications weren't working.
I could just tell things weren't right. When I talked to him, the responses I was getting seemed almost bizarre at times, and so as the evening progressed, his actions were just really different.
So they took another trip to the hospital. It was very clear Chuck needed a transplant and needed it soon. His other vital organs began to give out. Something had to be done.
It became apparent that we may lose him during that wait before we could get a donor heart for him. So we chose to go ahead and use the Heartmate 2, which would bridge him to the point where we can get a transplant. It's very small. It's about 2 to 3 inches in length and an inch or 2 in diameter, and it lasts potentially for 8 to 10 years.
It takes over for the failing heart, pumping blood throughout the body. Dr. Ransom says the procedure for implanting the Heartmate is not complicated, and the recovery period is usually short. Dr. Ransom says the device can sometimes be used for patients who don't even have the hope of a transplant. For Chuck, that means he can still go about his normal daily routine.
And so now they're saying, because today would have been a week, so now they're saying that I should be able to go home and have a lot better quality of life at home and waiting for the transplant at home instead of waiting for it here.
It's a lot of comfort to know that he's going to be able to make it to that transplant point. Yep.
Dr. Ransom says someday these devices may even replace heart transplants altogether.